A 29-year-old woman with terminal brain cancer has decided to end her own life on November 1st, 2 days after her husband's birthday.
Doctors told Brittany Maynard that she only has months to live and that her natural death would be very painful. So she and her family moved to Oregon because it is one of 4 states that allow physician-assisted suicide. How can a doctor help a person die? Good question. Heather Brown is here right now. So in this case, the doctor actually gives her the drugs and she takes them, correct?
Yeah, and that's a really important distinction to make here because the law says the patient has to be able to take the drugs themselves. The doctor isn't injecting Maynard because that would be considered euthanasia. And while that's legal in some European countries, it's not legal anywhere here in the United States, even in states with physician-assisted suicide or physician aid in dying laws.
I will die upstairs in my bedroom that I share with my husband.
To get the pills she says she wants to use,
It's in a safe spot, and I know that it's there when I need it.
Brittany Maynard first had to move to Oregon and establish residency. She then had to make a request to her doctor, wait 15 days, then request again. 2 people, one not related, had to sign and witness that request, and 2 doctors had to say she had less than 6 months to live and that she's able to make this decision for herself.
I've cared for hundreds of dying patients over the years where the patient or the family will say, can't you give them something to help them die?
Dr. Vic Sandler is medical director for Fairview Home Care and Hospice.
And I tell them very clearly, in Minnesota, we can't do that. We can't provide something with the purpose of ending someone's life.
Only Oregon, Montana, Vermont, and Washington have these laws, but in the other 46 states,
we follow the U.S. Supreme Court, which gives us great liberty in treating people that are terminally ill to ease their suffering.
Which can include rare treatments like sedation.
Even if it expedites their dying process, as long as the purpose and the goal of the treatment is to relieve suffering, then it's okay, then it's legal.
In 2013, 122 people in Oregon were written these lethal prescriptions. Only 71 used them, or 0.2% of all Oregon deaths.
What often happens is that people, once they receive this prescription, in fact, don't use it, but they avail themselves of palliative care treatments.
I can't even tell you the amount of relief that it provides me to know that I don't have to die the way that it's been described to me that my brain tumor would take me on its own.
There's also a huge legal distinction between these prescriptions and, say, taking somebody off a feeding tube, which would also cause them to die. Now, according to the Supreme Court, people do have a legal right to stop any treatments that they don't want anymore. And Dr. Sandler thinks there's going to be even more of a push for these laws as baby boomers get older, because baby boomers have had fewer children. And since children are still the primary caregivers for older adults, there'll just be fewer caregivers and more of a need for these types of laws.
Heavy stuff.
Yeah. It
but
really
we
is.
learned a lot.
Yeah, absolutely.
Right. Thank you, Heather.
If you have a good question for us, you can email Heather by going to WCCO.com/links.